So as it was already stated this evening, the Restart and Recovery Plan was a collaborative effort involving so many stakeholders. And I think it truly represents the voice of concern and a genuine effort to try to do the best job that we possibly can to get our students back into school safely and to address all of the concerns. The document's 104 pages long, and what we've done is we've created a number of appendices to sort of share out some of the highlights of each of the components of the plan. The first Appendix A, covers the area of critical areas of operation and general health and safety guidelines, which of course have to be at the forefront of all of our planning and all of our efforts. So what we have decided is to put in a very comprehensive protocol for high-risk staff members. The district is engaging in an interactive process. It began today with emails communicated to all district staff. And it's going to require the staff who are requesting accommodations due to medical and or childcare necessity, as outlined in the Family First Coronavirus Response Act and the CDC guidelines. Staff members are going to be asked to consult with Human Resources. The department has a dedicated email account where all staff members can communicate with us if they do, in fact, have a need for some kind of a leave or some kind of accommodation. And we're just getting started, and we will be dealing on a case-by-case basis and trying to be as supportive as we possibly can. Okay, Mr. Ranella. It's a very long document.
Chris, we're still on Appendix A.
Okay, so what I just discussed to you is the highlighted section of the critical area of operations, general health and safety guidelines, and it does address what our protocol is going to be to deal with high-risk staff members who do need to request some kind of a leave because they become ill or some kind of an accommodation, whether it's medical or due to childcare needs. Mr. Ranella, I think you are up next.
It looks like Mr. Ranella may be having some technical difficulties.
Okay, do you want me to start going through this one, Kim?
Yes, thank you, Mrs. O'Hagan.
Okay, so we also have protocols that we're putting in place for high-risk students, and highlighting the components of that plan are that parents are going to be asked to consult with their child's building administrators, with the CST caseworker, with their 504 manager, most importantly, the school nurse, regarding their request for any kind of student accommodations.
There he is.
All right, can you hear me now?
Yes.
Okay, sorry about that. Technical
Okay,
difficulties,
we're up
not
to,
sure
we're
what
up to,
happened.
up to number 2, Mr. Ranella.
All right, so area 2, critical area of operations, classroom testing and therapy rooms. So all staff, visitors, and students will be required to wear face coverings while on campus or in district facilities. We understand that sometimes it will be difficult for younger children or individuals with disabilities to wear the face masks when 6 feet distancing is not obtainable. But we will be working with them, the staff will be working with them to develop their stamina And also throughout the day, they will have opportunities to take mask breaks. Number 2, there will be signage throughout the buildings, just helping to remind students and staff of what 6 feet social distancing looks like. So that will be posted throughout the building. And staff and students will be encouraged to regularly wash their hands for at least 20 seconds with soap and water, especially during times of exposure to common spaces and areas such as doorknobs, desks, coughing, things of that nature. Number 4, classroom desks will be set up to maximize, when possible, the 6-foot social distancing. It is possible that there will be classrooms that at times we will not be able to have total 6 feet separation because of class or student enrollment. Throughout the buildings in the classrooms, there will be sanitizing products available. There will also be sanitizing wipes in the secondary classrooms for students to be able to wipe down their desks as they move from class to class. And we are now at Appendix C, which is Ms.
Yes.
Dougherty.
Yes, thank you. So based upon our committee work and the guidelines that we received from the DOE on transportation, we developed the following plan, specific to Middletown. And I'll just hit on some of the highlights. Based upon our transportation structure, we are not going to be able to accommodate 6-foot social distancing on buses. We don't have the bus capacity and space to run the routes, even with reduced loads, with students sitting 6 feet apart. So that we were able to determine early. We are going to be asking parents if they want to waive transportation for the 2021 school year. And the main purpose of this will be to assisting us in planning routes and knowing what the loads are, and knowing how we can do seating and make other accommodations. But it's also for possible adjustments at the schools for student arrival and pickup. If we receive notification from a large amount of parents that they intend to drive their student to school instead of using the bus, we are going to have to probably look at, those drop off and pickups because, as we know, they are already hectic. And again, we will be going in cohorts, so it will cut down the number of students each day. But if the amount of students doing private transportation versus busing is going to be significantly higher, we'll have to make adjustments for that. All students are going to be required to wear face coverings on the bus, including while boarding and getting off the bus. Requests for exemptions for medical reasons will require appropriate medical documentation and review by district administration and the district school physician. A couple other things we wanted to highlight. One of the recommendations of the NJDOE that we'll incorporate is that when possible, the windows on the bus will be open to increase the fresh air circulation on the bus. Now, of course, that would be weather permitting. So we will, that will be on a day-by-day basis. Oops, this document is so long. Buses will be loaded. Another recommendation that was made was buses will be loaded from back to front as they complete their routes to school in the morning. That way students will not have to pass by each other. It will minimize that and unload from front to back. Another thing we discussed was, if a bus driver observes a student with symptoms of potential illness, which would be, excessive coughing, runny nose, lethargic, the driver will contact the transportation contractor that they're working for, and the contractor will in turn notify the school. And the reason for that would be so that the school staff could assess the student upon arrival. But we are making it clear that drivers are not going to be responsible for screening students for signs of illness. Now, this would only be in an instance where they notice something very unusual, but we are not going to be screening students before they get on the bus. It's not going to be the driver's function. Cleaning and disinfecting. We did start some of this actually before the schools shut down in March, and we were assisting the buses in getting them disinfected. The contractors themselves will perform complete cleaning and disinfection procedures on each bus every day. And we've also talked to them about doing it midday between the arrivals to school and the pickups from school. They will also be touching on touch points, common area touch points between runs, handrails and tops of seats and things like that. We will also be lending some assistance in that area. We will have our custodial and facility staff helping with disinfection between routes, when the buses are at the schools. I think those were the main points. I mean, there's other areas under transportation, but those were, we thought, the most relevant points to emphasize for the purposes of this discussion.
Okay, so Appendix D, Critical Area of Operations 4, student flow, entry, exit, and common areas. So Ms. Dougherty had spoken a little bit about the bus drivers not having the responsibility of doing the screenings. However, there will be visual health screenings of staff and students at designated locations at the school, and they'll be identified by the school's pandemic response team. In addition, every staff and student will be required to complete a daily screening prior to instruction beginning, and that survey or screening will have a temperature check where they'll indicate their temperature for the day. Throughout the buildings, there will be designated entrances to try to limit the amount of students congregating and reduce the number of students that have to enter through one single door. So there will be designated entrances based on grades throughout the buildings. At the high school and the middle school, students' lockers and locker rooms will not be in use. At the high school and the middle school, students will be allowed to carry their backpacks throughout the day to help with managing their school materials and their personal belongings, since they will not be able to use their lockers during the day. And also the staff will be encouraged to minimize the materials that the students will need to be moving with from class to class, and try to incorporate as much technology, Chromebooks, things of that nature as possible. Number 4, visitor and guest procedures. We are looking to minimize the number of visitors in each school during this time. So we are going to maximize the use of technology through Google Meets and Zoom. We're going to try to hold as many IEP, 504, INRS, parent-teacher conferences, any types of meetings that would normally be held, prior to March 13th would be held in the building when possible. We're going to try to hold those through either, like I said, a Google Meet or a Zoom platform. We're also going to have our PFA meetings conducted virtually, and parent drop-off of items, student items, will be limited to socially distanced areas of the campus, and they will be eliminated at the entrance of the schools. For those visitors that do need to come into the school, it will be by appointment only. Those appointments will be made with the appropriate personnel and the approval of the building principal. When they come into the building, they will have to go through a screening as well. We're asking each of the school's pandemic response team to determine the specific and detailed procedures for the visitor entry. But we will be looking to incorporate a stay in car procedure, very similar to what a lot of dentist and doctor offices are using at this point, where when the visitor arrives at the school, they will call and let the main office know that they're present, and then they will remain in the car until the meeting is ready to be held, and then they will be called to come into the building. Number 5, hallway and passing time. Each building will have a lot of signage in it, and it will help students and staff members to be able to identify which ways they will be moving. It will also have designated passing times to try to eliminate the amount of students in the buildings, in the hallways at one time. So we are also looking to possibly, depending on the number of stairwells, make directional stairwells going up and down. Again, trying to limit the amount of passing in the hallways. And during the time of passing, because 6-foot distancing cannot be established, masks will be required to be worn at all times. Number 6, student and staff bathrooms. We are going to look to keep as many doors open as possible in the bathrooms, student bathrooms, to increase circulation and ventilation. If we need to create barriers to block lines of sight, they will be established and built prior to the beginning of school. That way we can continue to keep the doors open. There will be a schedule for the custodial staff with continuous cleaning, disinfecting, and sanitizing of those bathrooms in the AM and the PM. And the facilities department will have a schedule for the school custodians to follow. And we are looking to limit the amount of students that are in the bathrooms, again, trying to keep that 6-foot social distancing. So each of the school's pandemic response teams will develop their own procedures for the bathroom use. Number 7, student entry and exit of the school buildings. As I had mentioned before, there will be designated entry and exit doors for identified groups of students. Again, probably based on grade level, again, to minimize the potential congregation of students and maximize social distancing. As you can see, that's a recurring theme as we go through this, looking to maximize the social distancing. It's important to note here, parent procedures and expectations will be established at the elementary schools for parents waiting to pick up their children. They will need to be wearing masks, continuing the social distancing, and it will be specific waiting standing locations. In the middle schools and elementary schools, there will not be holding rooms as they have had in the past in the cafeterias, the APRs. Students will not be able to enter the building and congregate in those areas. As soon as the students enter the building, they will be required to go directly to their classrooms. And that also goes for students that ride the bus. If the bus arrives earlier than expected, then students will remain on the bus until the doors are open and the students can progress into their classrooms. And the same thing goes for parents that are dropping off. If you arrive before the doors are open, we will ask that the students stay in the car until the doors open so everybody, again, can proceed directly to their classrooms. Number 8, for the faculty rooms, the school pandemic response team will consider the following. They will look to limit or possibly limit where teachers may be able to eat, look for other areas other than faculty rooms for teachers to be able to eat and staff members to be able to eat, and also looking at access to refrigerators, microwaves, and etc. Letter C, the offices. The main offices and the nurse's office will be equipped with clear desk shields and 6-foot distancing arrangements when possible. Staff meetings, again, when possible, will be conducted virtually. The school's pandemic response team will plan the scheduled frequent and multiple opportunities for staff and students hand washing. Again, another recurring theme, hand washing. Facilities and custodial departments will establish a schedule and procedure in place to ensure that the sanitizing stations are maintained, cleaned, and supplies are refilled on a regular basis. Number 11, the school pandemic response team will establish safe and socially distanced sign in, sign out procedures for staff. And we can move on to Appendix E. Screening, PPE, in response to students and staff presenting symptoms. I kind of touched on this earlier, but for screening procedures for students and staff, the parents and guardians of the students and each staff member will complete a daily screening for each student, which includes a survey with a temperature check prior to the start of the instruction day. If a student or a staff member arrives without having completed that screening, the parents will be contacted and given the opportunity to complete the screening, and the students will be put in a place where they can wait socially distanced until that screening is completed. If a student or staff member appears to be ill upon entry, then they will be rescreened by our school nurses. Students and staff with symptoms related to COVID-19 will be safely and respectfully isolated from others. Each school will have a designated isolation space where students and staff with symptoms will be safely isolated from others. If any staff or student at risk of COVID-19 exposure or symptoms, they will be sent home immediately. The parent and guardian will be notified, and it is expected that the parent or the emergency contact will be able to pick up that student within 30 minutes. Once a student is identified or a staff member is identified of possibly having symptoms, they will be required, as they will be at all the time, but just to reinforce that they will have a mask on during the time they're being waiting to be picked up. When we get a report of a positive COVID-19 or someone having close contact positive of COVID-19, we will follow the New Jersey Department of Health isolation and quarantine guidelines as applicable. Remote virtual instruction is always available for those students that are placed in isolation or quarantine. The attendance procedures will obviously have to be will adhere to those guidelines. So students that are isolated or quarantined or too ill while they're isolated or quarantined and have medical documentation will not be marked as an unexcused absence. It will be an excused absence. So those students that are quarantined and too ill to participate will be excused from school. Staff members following the isolation or the quarantine protocol will refer to human resources regarding alternate assignments and or exclusion for work. Number 11, students and staff sent home with symptoms related to COVID-19 who wish to return to school before the end of the isolation period must present proof of a negative COVID test and a medical note with an alternate diagnosis and be fever-free for 24 hours without fever-reducing medication. So they must meet all three of those criteria. Number 13, face covering guidelines for staff, students, and visitors are as follows. School staff and visitors are required to wear face coverings unless doing so would inhibit the individual's health or the individual is under the age of 2. Students must wear face coverings at all times unless doing so would inhibit the student's health. Enforcing the use of face coverings may be impractical for young children or individuals with disabilities, so accommodations in those situations will be addressed by the building administration and the school nurse. Some additional exceptions to wearing face coverings would be individuals in extreme heat outdoors or students with a documented medical condition or disability as reflected in their IEP. All right, letter F, contact tracing. If the Middletown Township School District becomes aware that an individual who has spent time in a district facility tests positive for COVID-19, the district must immediately notify the local health officials as well as the staff and the families as appropriate of a confirmed case while maintaining confidentiality. Upon notification that a student or staff member has tested positive for COVID-19, the local health department will work in conjunction with the school nurses and the trained contact tracers to determine the close contacts of an individual. And all close contacts will be called by the health department. Recommendations will be to quarantine. And close contact is defined as being within 6 feet of a person for at least 10 minutes.
Okay, Appendix G covers facilities cleaning practices. And I do want to preface this section by saying that really many or even most of the things that are listed in this section were already part of our cleaning practices, but we just felt that we would elaborate and detail things that are done just so everybody has an idea of what's done during the day in the building. So again, most of these things are not specific to our recovery and restart plan, but they're really there for informational purposes. A few of the things though that are they're new or specifically relevant to our restart and recovery plan is the increased use of disinfectants, and the frequency during the day. And as we say in number 1, we are going to be, at least for the time being, closing all the drinking fountains and just sticking with the bottle filling stations. We have increased those bottle filling stations in all of our schools over the last few years, but at least until it's determined that conditions will allow continued use, we will be not utilizing the drinking fountains. One of the things that we are going to be adding to our facilities department for next year, and we actually just started, the first step of that was to approve the job description on this tonight's agenda, but to supplement our current facility staff and our custodial staff, we've created a environmental worker position that will be solely focused on additional cleaning and disinfecting. So they will not be doing the role of the traditional custodial job, and what they're covering, they will not be, but they will be to supplement specifically the cleaning and disinfecting efforts in the district. The NJDOE included in their guidance that, it was likely that districts were going to have to increase their cleaning staff in order to achieve this. So this is what we are looking to do. We're going to be calling them environmental workers. So they will be focusing on helping the custodians keep up with all the common areas during the day. And as we have, different phases, and eventually when lunches are scheduled, they will be also a big help in that area as well. But, the main theme here is just to increase the frequency of following up on, all of our common areas and touch points. So we have detailed out here what happens at different times of the day and the different areas that we have. Again, most of these things were being done anyway, but we just wanted to detail them out here. This is something though that would be, that we talked about before when we talked about transportation. We did start doing this, so we would help the bus drivers, in their disinfection efforts on the buses to, hit touch points and do some additional disinfecting between runs. We talked about the concept of our isolation rooms, and that's something that's required under the NJDOE guidance, and we have specific procedures related to maintaining those rooms, and those will be areas that will be frequently visited, and touch point areas being addressed, and so forth, depending upon the activity in that room on a particular day. We talked about getting increased products, disinfecting products to use, and expanding our inventory of those. We detailed out here some of the things that we do in the HVAC area. Again, these things, most of these things were being done already, but a couple of the changes that we're making is to allow us to, override some of the controls we have on the systems in order to have them either start up either earlier or to keep things running overnight. We've always been in the mode of energy savings and trying to have our equipment work most efficiently. But in a situation like this, we really are more interested in having a continual flushing of the building with fresh air, and maybe not have things shut down with sensors and so forth. Again, those are all things that we geared toward being energy efficient, but in this case we're looking to override some of those controls and have the air flowing even when the rooms are not occupied, and constantly bringing fresh air into the building even overnight. We will keep up our recommended schedule of filter changes. We also have logs that are placed in each unit to show when the last filter changes had taken place, along with any other work that was done to prevent or repair issues. So that will continue as we've been doing. In addition, I just think it's important to note all the work that we've done on our HVAC systems over the past several years, as either part of the referendum that we did, and also our recently completed energy savings improvement plan. We've done a lot of rooftop unit replacements and other enhancements to the system that have allowed us to have units that are working more efficiently and hopefully more reliable. We've seen that the units are actually operating. So that's also been a good preparation for this as well. The fact that we've been able to do a lot of replacements and upgrades on our systems. The next appendix deals with meals. Initially, as we've mentioned, we are not going to be doing meals as part of the school day. So since we're going to be working on a shortened day schedule, meals will be distributed to be eaten off campus. The way we're going to do that to start the year, so that will be a grab and go. Breakfast will be available for students to bring home so that they can eat it the next day before they come to school. Lunch will be available to bring home to eat after the school day. There will be some exceptions to this for students who are scheduled for a full day, and we have determined that they will eat in their classrooms and or open space areas, when possible. And again, each school's pandemic response team will be involved in the specifics for each building. It may look a little differently depending upon the facility and the space that's available. We're going to be working on a pre-order app to be created to allow parents to order food for their students so that things will be available for them to, again, grab and go to take home. And that will make that more efficient. We also are looking at a procedure for students who are all virtual, who have elected to be an all virtual model, that there will be a distribution of those meals at buildings at certain dates and times so that parents can come and pick up food for their children as needed. We also are working with coordinating the distribution of lunch and breakfast for any students who will be participating in aftercare that will need lunch. So each building is going to develop procedures to facilitate that. We are going to be working closely with Whitson's to make this all happen. And, they, again, were very involved in the distribution of meals when we did the initial shutdown. in the spring. So, they are well prepared and will be meeting with us to make sure all of this gets facilitated. But the NJDOE guidance does specifically state that we can't offer meals buffet style or self-serve. They're really urging everybody to go to a more grab and go model with things being wrapped and packaged. Okay. The next area we have is recess and physical education. That's Mrs. Pekas.
Okay, so due to the NJDOE requirements regarding the cleaning of playground equipment after use by individuals and the limited capacity for staff to conduct such cleaning on top of the extensive cleaning protocols that will be happening throughout the school day inside of the school building, the playground equipment will not be used by students during the school day until such time as the DOE cleaning protocols are relaxed for playground equipment. There will be no use of shared equipment during recess for the same reasons. We will utilize and maximize our open field space and other areas for recess, and staggered times throughout the day will be utilized for students to have recess, and each school's pandemic response team will coordinate that scheduling. I do just want to note that many districts are foregoing including recess because many districts are starting with a shortened day, early dismissal, and recess is not required. However, we here in Middletown, after much discussion, felt that that was an important thing to include for our on-campus experience to make sure the students get those breaks. With regard to physical education, each of the high school and middle schools in the district will restrict the use of our locker rooms for students during the school day. That's again due to the required cleaning of such areas, quite extensive, as well as the inability to maintain social distancing in those small quarters. So students, as per the DOE recommendations, are encouraged to come to school dressed in clothes appropriate for participation in phys ed, sneakers, comfortable clothing, comfortable shoes. Each school's pandemic response team and PE department will coordinate communication to parents and students about those expectations. The pandemic response team at each school and the PE department will also create a staggered schedule and procedure for how students and when students will wash their hands upon returning from activity, whether it be inside or outside, because that is also required by the DOE. And lastly, with regard to recess and physical education, we will designate outdoor spaces, and the PE department will work extensively to maximize distancing between classes as well as between students in the same class.
Okay, so Appendix J, critical areas operation, field trips, extracurricular activities, and use of facilities outside of school hours. Number one, field trips, assemblies, and other large gatherings will be suspended during our pandemic situation. Two, all clubs activities that are normally running during the course of the school year will be held, and they will be in accordance with our district's phased reopening protocols. Clubs may be able to meet in person as long as the social distancing guidelines are adhered to, and depending on the club size and the indoor restrictions. If the social distancing guidelines cannot be met, then the clubs will meet virtually. And for any club that does meet, students will have the option of attending virtually as well.
We have also talked about the use of facilities outside of school hours. And at this point, we are planning on limiting the use of facilities outside of school hours to school-sponsored activities until further notice. That will be to allow for the buildings to be properly cleaned and maintained, while the students are not there. Obviously, this takes time, and we're really looking to minimize the use of the buildings. We don't have it mentioned here, but that this would not include any aftercare that we would be operating. We're still in discussions with the Y on how that would look, but that would be something that would be an exception to this no use of facilities outside of school hours. And it also wouldn't include outside spaces. This would be just for the buildings themselves.
Okay, Appendix K deals with academic, social, and behavioral supports. With regard to the academic supports, many of the schools in the district receive funding through the Federal Elementary and Secondary Education Act, which is used to improve achievement in literacy and mathematics of students through before and after school programs throughout the year. It is also used for enrichment programs and/or summer programming. The district, as Mrs. Tiedemann updated you on earlier, is currently implementing a hybrid extended school year program in accordance with the NJDOE Safety and Health Guidelines previously mentioned. The district's Summer Opportunities for Academic Readiness, the SOAR program for students in grades K to 8, provides students virtual small group targeted instruction in ELA and mathematics. This program began this week and will continue for a total of 4 weeks. As a result of the need to shift to virtual home instruction last year, the district is offering a new virtual AP summer program during the month of August for many of the AP courses to help students successfully meet the challenges of AP coursework in the upcoming school year. Please note that this list is not all inclusive, as the district does have other academic supports such as the Algebra 2 Jumpstart program and the summer book clubs for students. Mrs. O'Hagan will now speak to the district's social and behavioral supports.
Thank you. One of the first things that was really important in the Mental Health and Social Emotional Learning Committee was acknowledging and recognizing the fact that Middletown School District is in fact going to have to recognize that social emotional learning is going to be a critical area to re-engage students, to support staff, and to rebuild relationships and to create a foundation for academic learning. We know that with the amount of time lapsed, there's going to be a certain level of familiarity that will have been lost, and we're going to do everything possible to put supports in place to put those feelings of comfort and support back in place. A detailed compilation of staff, social emotional learning, and mental health resources has been established, and it's going to be disseminated on a continuous basis. The reason for the continuous basis is because new resources are coming online all the time. The committee has deep roots in the field of social emotional learning and mental health, and their efforts have allowed us to bring many, many resources into this compilation, and we know we will add more as time goes by. They're going to include, but not be limited to, staff self-care and wellness, access to mental and behavioral resources, and professional development pertaining to social emotional competency. Additionally, the district is going to utilize both staff and caregiver surveys to begin the process of collecting and processing information from stakeholders. We have an idea of how things are going to go, but we're going to need to be in that continuous feedback loop where we get information from our stakeholders to help us guide the continuation of our support for social and emotional learning and well-being. An SEL and mental health inventory was created to collect and house information regarding supports, programs, and resources that are occurring in various buildings and at different levels throughout the district. The purpose of this inventory is to promote the sharing of collective knowledge, skills, and faculty and staff experiences across the district. We know in a district our size, with the skill and the talent and the depth of knowledge, that we can benefit by collaborating and sharing experiences, especially in the area of guiding students and staff to social emotional well-being. The Middletown Township District has established community partnerships with mental health providers and school-based collaborators such as the YMCA and CPC. A range of supports and services and resources are going to be available to students throughout the district through an integrated model of tiered support and services. And the Middletown Township Public School District is currently working with developing a working relationship with several universities that will allow them to place mental health interns into our school district to help us with programs, to develop the programs more fully to meet the needs of students and staff and to deliver those services. Okay, I think we're up to Appendix L. Mrs. Pekas.
So the district formed, as many of you know, a reopening of schools or restart committee. As per, we actually were ahead of that, but it was also consistent with NJDOE guidance. We had 7 subcommittees. I'm sorry, that's a typo. It should be 8 subcommittees, and they are all listed there. They met regularly over the last couple of weeks, and they consisted of multiple stakeholder groups, representative of staff, community partners, parents, township representatives. So we had quite a group there, or as Dr. George has always mentioned, over 150 individuals. So the subcommittees issued reports and recommendations to central office administrative team, as well as the building principals. That information is what you see here tonight in the final plan. They will continue to report up to central office administration, as well as the building principals. And the district committee, the reopening committee, will interact at this point and interface with the school pandemic response teams.
All right, tonight you heard a lot of reference to the school pandemic response team, especially as it related to health and safety. And that just points to the significance that this team will play, the role that this team will play in implementing the plan at each of the different school buildings. Each school will have a pandemic response team, and that team oversees the implementation of this restart and recovery plan at the building level. And like I said, particularly in the health and safety protocols. Each building is unique. And this plan, while it is very specific, there still needs to be decisions made at the building level to implement the plan to meet the needs of that unique building and the student and staff populations of that building. Some of the responsibilities they will have is to provide support and training to staff. They'll monitor health data and report those findings to the district administration. They will also work to maintain a safe and supportive school climate. A particularly important responsibility will be coordinating communication, whether it's getting information out to the community or seeking their feedback in order to inform their decisions. The team is going to be made up of a broad section of school community members, teachers. I mean, you see the whole list there. There really is an extensive and broad range of community members that will be part of that team. And as I said, this is the essential team for actually implementing the plan at the building level. So it plays a really, really important role.
Okay, the next section of the plan captures the schedule for students and staff. Our district is committed to returning students and staff to in-person on-campus instruction safely, however expeditiously, and as soon as possible. But the important thing there is safely. Dr. George communicated with the entire district last Friday afternoon with all staff and then with all parents and caregivers regarding the schedule of students and the schedule of staff for reopening in September. We have taken the approach to design a very phased in model for reopening of our schools. The phases reflect our ambition to make sure that students are coming back and their needs are being met. We are taking this time to also improve upon our virtual instruction methods. We did collect feedback over the course of the spring and early in the summer from our caregivers as well as our staff members. That feedback was vital for the committee to review and reflect on, and we're beginning that work now of making enhancements. Over the next couple of weeks, various committee members will be meeting with representatives of the curriculum department to begin talking about best practices for virtual instruction that will include both synchronous, which is in real time, face-to-face type instruction, as well as asynchronous learning activities, which are also just as important in a virtual learning model. They will both be included in our hybrid model approach. So the phased reopening of schools and the resumption of in-person learning also supports a safe return of students, as I've said, and staff to our campuses. Administrators will work collaboratively with the Middletown Township Department of Health and the district physician to monitor our local health conditions, including COVID-19 positivity rates and instances of staff and/or student quarantine or isolation, in order to determine when it is safe to advance to the next phase of reopening of schools. Moving to advanced phases of the district's reopening plan consequently increases classroom population densities, or the number of students in each classroom at a given time, and therefore reduces social distancing opportunities. The decision to advance to a subsequent phase of reopening must be in compliance with the state, NJDOE, and CDC guidelines that are in effect at the time the decisions are being made. In addition to lengthen the school day and expand it throughout the reopening phases in order to reintroduce on-campus lunch service, we will monitor those same conditions and also monitor the state's reopening and expansion of indoor dining capacity. As Mrs. Dougherty has mentioned, until such time, grab-and-go breakfast and lunch will be available to all students. As directed by the state and the DOE, the district must be prepared at any time to transition back quickly to an all-remote and virtual model of instruction at all levels and for all students, should local and/or state health conditions require such a change. And we will work over the next couple of weeks to ensure that that is the case. Throughout the course of the next school year, caregivers and parents will have the option to elect for their child to receive instruction remotely every day. The governor made that announcement on Friday. That is part of his orders now. We had already planned, to include that, but it was formalized by the governor on Friday. We will have a form on the website within the next day, maybe two. We're working on that. We're developing it in real time so that caregivers can inform the district if their child will only participate with their classes remotely. At this time, we're expecting parents to have that form returned to the district by August 4th. Again, that will be a form to notify the district that your child is only going to participate in full-time remote virtual instruction and not participate in any on-campus instruction. Caregivers and parents who elect to start the school year with their child only receiving remote virtual instruction will have the opportunity at different times during the year to reintroduce their student to on-campus instruction. And that is described in our phased approach below. In addition, caregivers who elect for their child to participate on campus for in-person instruction have the option to shift to an everyday remote instructional model if they begin on-campus instruction and they determine that it is not a good fit for them or their child for whatever reason that may be. So we're going to quickly highlight the different phases. Phase 1 is September 1st through 3rd. That is reflected in our new revised calendar. That will be dedicated to staff professional development and workshops dedicated to ensure that our reopening is as smooth and efficient as possible. Phase 2 will be re-entry meetings that we will conduct. Every student and a caregiver will have the opportunity to meet with a teacher or a support specialist, staff member from the district, to talk about various items such as their academic progress, their needs, social emotional topics, and their needs regarding that, as well as evaluate their technology needs, discuss expectations in terms of the socially distanced classroom, virtual online expectations, and as well as just talking about any concerns that the student or caregiver has. So phase 3 begins the actual academic school year for our students. And this will be, again, we will start with an early release schedule of 4 hours and 15 minutes for on-campus instruction. However, students will be expected to continue and complete work in the afternoon following their on-campus instruction. And that will vary from grade to grade. And teachers will make those decisions best suited for their students. Each class will be divided into 2 distinct class cohorts or groups. There are some exceptions and they're noted below. That again is necessary to reduce the overall maximum capacity in our classrooms to be able to ensure social distancing measures are in place. Again, we're going to reinforce, I know Mr. Ranella mentioned this before, even with reducing our classes into 2 cohorts, we will not be able to maintain 6-foot social distancing at all times. That will be dependent on different factors such as the room size and the student enrollment. Therefore, students will be masked, we'll have face coverings, and teachers will look to work in mask breaks periodically when 6-foot social distancing can be maintained. Class cohorts will be created based on students' last names to maximize opportunity for siblings and family members to be assigned to the same weekly schedule. The organization of students by last name is listed there. A through K will attend on-campus in-person instruction on Mondays and Tuesdays, and students with the last names beginning with L through Z will attend on-campus in-person instruction on Thursdays and Fridays. We do want to take special note and encourage parents, if you have siblings in the household who have different last names, we cannot determine that, automatically from the reports we run. So we do encourage parents, if you have siblings in the same household with different last names, please reach out to your respective child's principals and work through those cases. That is one exception that we will work through with families. Again, because our goal is to have siblings in the same cohorts. So during remote virtual instruction, teachers will include elements such as webcasts or streaming. Opportunity for face-to-face instruction and interaction between teachers and classmates who are either in the classroom or learning from home. That will especially be utilized when the teachers are introducing skills and concepts through direct instruction, whether that be mini lessons or modeling or read alouds or shared opportunities. We will also infuse asynchronous or independent learning opportunities in all grade levels as appropriate and develop, especially developmentally appropriate. Some elementary special subject areas will be scheduled virtually. The principals at the elementary level are working with Mrs. Orozco, our Director of Physical Education and Science, as well as Mrs. Caruso and Mr. Graziano to coordinate that. Middle school and high school students will follow their regular daily schedules at a reduced or compressed time frame. So their blocks or their periods will be reduced from their normal length. Therefore, students will be changing classrooms and interacting with different groups of students throughout the day. In order to continue offering our comprehensive assortment of electives and multi-tiered and leveled core content subject area classes, such as our college prep, our honors, and our AP. We are unable to create cohorts at our middle school and high schools as we can replicate and create at the elementary level. And that is why students will have to continue to move between classes. We didn't want to reduce our number of elective areas or elective offerings, and we wanted to maintain as much as a regular experience for school as possible for our middle school and high school students. Due to their organically smaller class sizes, students enrolled in our special education class programs such as LLD, multiply disabled, behavioral disabilities, autism, and pre-K will be scheduled for in-person on-campus instruction each school day, Monday through Friday. They will not follow a cohort hybrid schedule that was previously described. That also, I just want to explain there, we have had some questions. That is all of our pre-K classes. It's our pre-K disabilities as well as our integrated program. We will be running them on a full 5-day schedule, Monday through Friday, according to their regular times. Students enrolled and eligible for related services, in-class resource, replacement resource, and or supplemental support, as well as our English of second language students, ESL students, and tiered interventions may be scheduled for additional in-person on-campus instruction on Wednesdays, which is our virtual learning day, as scheduled by their school child study team, administration, and or INRS team. So the schools will be reaching out to those parents where that is needed to arrange those services and those opportunities. In addition, depending on the number of students who choose to participate or parents who choose for them to participate remotely, if we have additional space in our cohorts, students with programs such as in-class resource, replacement resource, ESL, or tiered intervention will be scheduled by the school for additional days of in-person on-campus instruction. But again, that will be on a case-by-case basis, from school to school, from class to class, when there is opportunity to do so and space within the classroom. So in phase 4, once we get through phase 3, our anticipated start date would be about October 12th. If we monitor the level of community transmission of COVID-19 within our community, as well as the staff and student attendance rates. During phase 3, we will consult with the Middletown Township Department of Health and our district physician, as well as the Monmouth County epidemiologist, to measure those data points and determine if it is safe to move to phase 4. During phase 4, we will increase our cohort sizes at a reasonable rate. At this point, any student who receives in-class resource, replacement resource, ESL, or tiered intervention, if they haven't already been added to both class cohorts, they will be at that point have that option to do so. The parents still retain the choice not to increase their days on campus for their students. The length of the school day for in-person on-campus instruction may be increased at this point, and lunch service may resume if the state has eased indoor dining restrictions and the district can schedule students for lunch service while also maintaining the state's prevailing social distancing guidelines for schools. That is a period of about another 30 days or so. So then we would hope to be entering phase 5 at and around November 16th. Again, could be earlier, could be later, depending on our health data. The district, again, will monitor all of the data points and consult with the Department of Health, the district physician, to determine if it is safe to, again, increase our cohort sizes. If the data suggests that it is safe to increase our cohort sizes, and students who have been participating remotely from home since the start of the school year will be given the opportunity at this point to be added into one of the classes cohorts. Again, increasing our cohort size at a reasonable rate. Again, if the length of the school day was not increased in the previous phase, then we would look to do so now. Again, if the data is positive, trending in the right direction, and we don't have increased levels of community transmission, or we don't have high rates of absenteeism or issues for quarantine or isolation, we would move into phase 6. So in phase 6, we're basically looking to resume our normal schedule. All students back on campus for in-person instruction. Again, parents would retain the option to not have their students elect to do that. And if we hadn't lengthened the school day in October or November for whatever reason, because of the state's indoor dining restrictions or our inability to socially distance students to resume lunch service, we would absolutely be looking to do that at that point. Again, watching the health data and the trends of absenteeism and quarantine. So you can keep going, Mrs. Dougherty. The sample schedule is below. Those are the start and end times for students when they're participating in campus. In person on campus. You'll notice that the staff is working a full day in the afternoon, as I mentioned earlier, after they have their opportunity for their lunch and their remaining prep time. Additional student contact time will be scheduled with students and their teachers.
Okay, Appendix O deals with staffing. I'm going to be discussing some of the items that deal with staffing and curriculum and instruction. As a result of the need to shift to virtual home instruction last year, at the start of this school year, appropriate staff will determine the standards and/or skills from the previous grade level and/or courses that may need to be revisited, as well as identify the curricular priority areas for the upcoming school year. It is understood that modifications to instruction and curriculum as per a student's IEP will be implemented as specified in that IEP. Plans will be created to address the use of curricular materials for both in-person and remote virtual settings. For example, manipulatives in mathematics, art and science, supplies, etc. Moving down to number 6, the district will prioritize the most critical prerequisite skills and knowledge for each student subject area and grade level. They will train teachers and leaders to evaluate students' academic achievement gaps and provide appropriate support. The district will plan to approach diagnosing students' academic achievement gaps in prerequisite content knowledge and prerequisite skills, keeping in mind that during virtual instruction, the type of learning experiences that are appropriate will vary based upon the grade band and content area. Adapt the curricular scope and sequence pacing for each subject area and grade level to accommodate where teachers might need to provide acceleration support. And monitor students' progress on grade appropriate assignments and adjust supports for teachers and leaders based on student results. Moving down to item number 13. The district will utilize the following strategies with respect to student assessment as school reopens. Clear and consistent communications with stakeholders. Inventory current sources of student performance data with a focus on those that may be administered while adhering to social distancing practices, being cognizant of the limited time that may be available to work with students in the classroom. Sources may include, but are not limited to, formative classroom assessments, student observations and self-assessments, readiness screenings for pre-K and kindergarten students, district benchmarks, several of which are listed right there on that page for you, traditional and performance-based assessments, and social emotional learning needs assessments. After preparing data for examination, teachers, administrators, INRS teams, etc., will interpret the data and factors contributing to students' performance, and specific actions will be taken to meet the needs of all students, special education, 504, English language learners, G&T, students, etc., tiered intervention students, etc., and create student SMART goals. This may involve, but is not limited to, grade level, vertical and content area articulation, what I need, called win time in the elementary schools, the advisory period in the secondary schools, collaborative goal setting, frequently updated intervention logs and tracking sheets, SMART goals and SMART plans developed by intervention and referral service teams, IEPs, and 504 plans. Moving down to number 14, the district will provide professional development schedules and staff articulation collaboration time on a regular basis and in accordance with the determined needs, such that professional learning experiences promote high quality instruction for all students. In addition to input collected from the district school reentry planning committees, a survey of needs to gain input from staff will be conducted, and the district and the data collected from these needs assessments will drive the planning of professional development sessions, with the sessions including strategies and applications to reach all learners. Professional learning will foster each educator's capacity to deliver developmentally appropriate and standards-based instruction in the hybrid or virtual model of instruction. Number 15. A home-based learning academy will be created to better support the parent and caregiver in the hybrid or virtual learning environment, such that topic choices will be based on feedback from community stakeholders. Video tutorials will be created for topics such as Google Drive, Google Classroom, Google Meets, Clever, classroom assessment practices, etc. Student tutorials will also be created. Topics for these will be based on feedback collected from staff and community stakeholders. Choices will include successful practices in the virtual hybrid model of instruction, Google Drive, Google Classroom, Google Meet etiquette, Gmail, Clever, password management, and effectively communicating with teachers, among other things. Okay, now Mr. Suiak will address other areas related to staffing.
Sure. The district will strive to ensure that every student and staff member has safe and equitable access to a learning device and internet connectivity to support remote virtual instruction as necessary. Surveys were created and shared with all pre-K through grade 12 caregivers to determine technology device and connectivity needs. The results of those surveys, along with the comprehensive inventory of all current technology devices, ensure that we will have internet connectivity via AT&T Wi-Fi hotspots for all students and staff on an as-needed basis and by request. And devices for students in pre-K through 12 will be available for use for all students. The Technology Committee has also identified several instructional technology applications that will be used by staff and students during hybrid, in-person, and virtual learning. The Professional Learning Committee, like Ms. Caruso just mentioned, is planning training sessions led by teacher leaders and specialists prior to the students' first day of school. In addition to Chromebooks, Instructional hardware has also been purchased to support educators in implementing this virtual hybrid learning activities, which include webcams. The following procedures will be followed to ensure safety of Middletown staff and students. Immediately upon arrival, all devices returned for repair will be thoroughly disinfected and sanitized using EPA-registered disinfectant and microfiber cloths. If possible, all in-class technical support will be completed remotely or when the classroom is not occupied. And this true one-to-one environment will allow students Chromebook use without the need of sharing. So each student in grades pre-K through 12 will have an individual device assigned to them and will only use that specific device unless there's a need for repair.
Okay, one of the things that we know that we have to deal with during any school year is the possibility of staff being absent for a number of reasons. In this situation, it's going to be especially important that we have some kind of control over the substitute staff we bring in for teachers, secretarial staff, and paraprofessionals in terms of where they've been and making sure that we're doing everything we can to keep our students and our staff in a confined circle of contact. So what we're doing is we're going to establish a very comprehensive plan that will address staff absences due to COVID-19 related illness or quarantine and for any other reason. We are working with our substitute contracted service provider to establish a consistent roster where the same substitutes will report to a designated school every day to cover staff absences. They will be reporting to those schools regardless of whether or not there is a teacher absent. They will be assigned to other duties as we further vet out this plan. But this way we know that those substitutes will be available on a regular basis if the event of absences. The substitutes that we bring in are going to receive the same training that our regular staff gets regarding professional development to follow all of the district's restart and recovery planning and make sure that they will be at the ready to support our students and staff.
The next appendix deals with athletics, and the district continues to follow the New Jersey State Interscholastic Athletic Association return to play guidelines. So I'll review the current model in place. Currently, we're in the summer session, which runs from July 13th through August 28th. And this is a three-phase approach to return athletes to the campus for preseason workouts. Each participant goes through a daily screening checklist and a temperature check each day. And each phase gradually increases the pod or group size. It increases the equipment we can use and increases the practice time that we can have at that time. I should also note that the marching band and cheerleading will kind of use the same phased-in approach during the summer session. After that, the August 29th through September 13th is the virtual period, kind of corresponding with the start of school. All contact with athletes will be virtual. There will be no in-person practices or any scrimmages at that point. And then at this time, the fall season will start September 14th with our traditional practices, and our games should commence around October 1st with our schedule being done as we speak. The middle schools will kind of follow that same fall schedule at that point. And as always, that is subject to change.
I think that's it.
That is, we just have a list of resources at the end. That's it for the appendices.
Can I just say something, because I realized that we missed an important item. That's attendance, and this in these appendices in this policy and regulation plan, we do have a policy for attendance where students, if they are ill, whether it's COVID or a common cold, when they're home, they can log on to the synchronous virtual instruction in the classroom. And when they do that, they will not be marked absent. They will be marked present. Students that are too ill to log on for whatever reason, they can bring doctor's notes into the nurse's office when they come back to school. And that will be considered for an excused absence.
Mary Ellen, may I ask a question?
Sure.
When the students have to log on, do they have to be with the camera on so you know who's on the computer?
I would think that would be, it's not necessary, but it would be encouraged. There's more than just logging on. There's actually participation in class.
Right.
There may be discussions that they're involved in with their microphone. So, you know, the teacher will have a pretty good idea of who's sitting behind that computer.
Why wouldn't we have the camera on? Why wouldn't that
Yes,
be a
attendance will
discussion?
be taken, and as Mrs. Walker said, they will be participating in synchronous instruction. So the student will have to be present.
Yes.
Okay, because I think, you know, that's accountability for the student too.
Yes.
Thank you.
I have a few questions. We talked about the high school and the middle school changing classes. Who's going to clean those rooms in between the class changes?
Well, we talked about the concept of having wipes available for the students to use on their desks. The rooms will not be, you know, we will not have the staff to have custodians come in to do complete cleanings, but the desk surfaces will be addressed with the wipes that are available in the rooms. And in addition, you know, the custodians and the environmental workers will be constantly addressing touch points in the hallways, such as door handles and handrails and things of that nature. So those will be addressed in between classes as well, bathrooms, etc.
Okay. In the elementary, we talked about the kids will have some kind of instruction in the afternoon. What will that look like? Because you have to give them time to get home and have lunch.
Correct. And the teachers have to have their lunch and their additional prep time as well. So it'll be scheduled through the teachers. That will be most likely small group instruction. That's when that win time will be scheduled that we discussed previously. That is usually one-on-one or small group instruction. The students will have asynchronous activities to be completed at home to continue their learning. So that's independent activities. And there will be virtual specials as well, because we won't be able to get all their specials in person.
That was my next. What subjects will be taught in the elementary schools in person?
All core subject instruction will occur in person and also virtually, because again, it's a combination of synchronous, in person, as well as asynchronous, you know, independent learning. Right now, Mrs. Orozco again, Mrs. Caruso, Mr. Graziano are working on the special subject schedule with the principals. It is likely that the vast majority of elementary specials will be scheduled in person will be the physical education portion.
Okay, another question is, the kids that are virtual can only come back at a certain phase. What happens if the numbers are low in school? Well, they won't be allowed to come back sooner if they decide that that's what they want to do?
Well, our first priority, as we discussed, is to fill any vacant seats or openings class to class with our special education students, our in-class resource, replacement resource, our ESL students, and our tiered intervention students. So those will be the first group of students that we'll look to bring back and increase cohort capacity sizes with. The first time the students who start remotely have a chance to come back is early on in the phases. It's right after that we bring back the students in the special group populations. So it's pretty sequential. It's pretty soon after they start, you know, virtual.
Because if we have somebody new that enrolls in a district and they want to start in person, they would be allowed to, correct?
If it depends on if there's space. If there's not, then they may have to start virtually if they enroll once the school year has started.
Yeah. And we got an email on this and somebody said that it was answered, but I didn't see anything through our emails. The consideration for caregiver schedules. Are they going to have the flexibility to switch or no?
So that was a topic that our principals brought up and we discussed with them at length. Their recommendation from the buildings was that with the complexity of scheduling these cohorts and trying to balance them, as well as trying to take into account getting students who have different last names, who live in the same household, matched back together, as well as balancing our special education students to make sure that all of our cohorts are heterogeneous and we don't have any overscheduling of special education students in one cohort. There's a lot that goes into balancing those classes. So we are just unable to take special requests at this time for switching cohorts because there's just so many factors that go into this. At the high school level, we have to factor in our vocational students. We may need to adjust their schedules to match the vocational school schedules. And also at the high school level, we also have our early college students. So there's already exceptions that we have to balance for scheduling reasons, for programmatic reasons within the school. And those are natural, that we have to take care of those first, and those have to have priority.
And the next is, do we really think August 4th is enough time for people to get back to us?
Well, if we don't have answers by August 4th, it's really going to limit the school's ability to schedule. So it's going to delay the scheduling. It's going to delay their ability to identify where there's extra capacity to add special groups back in, such as our special ed students, to additional cohort days. So we really need to have that information as soon as possible. It is a week, and that is pretty consistent with what almost all the districts we've seen, are providing.
And just a comment, and maybe it's wrong, but we're going to send letters to people asking them if they're going to go virtual. Why wouldn't we put on that form, are you going virtual or are you going in person? So that you know for sure what they're doing, because if they don't answer, we're going to have to follow up some way or another, right?
So we've talked about that. That's something that we're actually discussing with our attorney in developing the form, because the state really hasn't given much guidance other than we have to give the parents an option to do virtual, and they only addressed virtual on Friday, and they only addressed having a form for virtual, but we are discussing that as a district.
Yeah, because it would make sense if you ask them, are you doing virtual or are you going to do the hybrid?
Correct.
And then it's going to take time to follow up for all the people that don't answer, because they could just show up at school, in person.
Well, we will plan anybody who does not respond to us saying that their child is going to be participating only virtually. We have to schedule them as if they're going to be in person. That is the assumption is that students are going to be attending in person. That's what we're hoping for. We want students to be on campus. We want them to be participating in person instruction. So the default assumption will be, if we don't hear from parents, we will be scheduling them for in-person instruction.
And the last question I have is, what will the labs, cooking classes, theater, bands, what will those classes look like?
It's going to look different. It's going to look different in every classroom. That is the reality of the situation that we're facing right now with the restrictions that have been placed upon us from the DOE. In terms of science classes, I know Mrs. Orozco is here. Devin, please feel free to chime in, unmute. We've been talking about this. She's going to be talking to some teachers in the departments, as well as the phys ed department, and Mr. Graziano will be talking to the life skills teachers and the career study, those career electives like sewing and cooking. Go ahead, Mrs. Orozco. We can talk about the modeling, a lot of teacher modeling, right?
There is. So I've been involved in a lot of conversations at the state and the national level at this point about both science and physical education going on in buildings. How much can we do in classrooms? What materials will be safe for our students to use? And there are a lot of us working together in different groups to try to come up with some really innovative activities that our students can do. Unfortunately, mostly digitally. But it is, my goal to make sure that we have those activities that align with our state standards and allow our students to have experiences that are genuine and authentically science, even if it's not doing the same chemistry experiments that we all may have done in our own high school experiences. So I am working real hard this summer to try to make sure that we can provide those experiences for all of our students.
Thank you.
Kim, I have a question. You said that we're going to be, as far as if they do not send back the paperwork saying they're going virtually, we're going to assume that they're coming back to school. If everybody came back to school, we could accommodate it?
We can accommodate it, but again, from classroom to classroom, it's going to reduce your social distancing. So by splitting them into the 2 cohorts every class, we've already created capacity for social distancing. In every classroom, depending on enrollment, it may not be 6 feet. It may be less than 6 feet.
Okay, thank you.
I just have a couple questions. Going back to the required mandatory screening form that every student must have upon entering the school building, I may have missed this, but I thought I heard you say that if the student doesn't have the form, they're going to be put in a holding room. The parents will be notified until a screening can be done. Is it the school nurse that's doing the screening?
No, actually, we're looking at either an app or using a Google Doc to for the parents to be able to go and use their phone or their computer to send it to the school every day. Those parents who don't have that can use a paper copy. But if the student doesn't have the form or the parent hasn't filled out the app, a phone call will be made and the parent can fill it out right there. Say, oh, I just forgot to do it. Here it is. She might not have, or he might not have taken the temperature. Our nurse could take the temperature, and that would be the end of it. There's questions on there like, have you been in close contact with someone who has had COVID symptoms? Like, we wouldn't be able to answer that, especially for a younger student.
Right, and that's what I thought, because if it's modeling what you have to do now at a doctor's office or a dentist's office, it's more than one question. But I also think at some point, yes, you need the parent to answer or the caregiver to answer those questions. But I think at that point, you might as well, if the nurse is there, just do the temperature check as well, if that can be done.
Exactly.
The other thing, going back to the inability in middle school and high school to try and clean desks in between classes, clearly, I mean, that is going to be a huge undertaking if to try to do that and then have the students responsible for it. Is the teacher monitoring at that point to make sure that every student actually does wipe down the desk? Because the other thing too, with a lot of these cleaning products, clearly you need bleach at this point to kill these viruses, but it has to remain wet on the surface, right? And then air dry, which is going to take time. Is everybody going to start touching all of these desks? I think these are questions that a lot of the parents are probably going to have in terms of how this is really going to be effective.
I mean, the only solution that we've been able to come up with so far is to, again, have the wipes available for the students. I don't know, and I guess this would be open to discussion, how much of the students would be pressed to do it, to sit at their own desk. I mean, it would basically be, we would think the teacher would be reminding everyone to do it and, encouraging them to do it. But I don't know. And if anyone else wants to chime in, whether that would be something that would be subject to, anything further than that, I'm not sure that that's what we envisioned. It would be the same as people going into a supermarket or something else and taking a wipe and wiping their cart, or, when we used to be able to go to the gym and wiping the equipment and so forth. As far as using stronger cleaners like bleach and other, we have other disinfectants that we're using that are, certified to kill the virus, but, that would be things that we would be doing, after the school day, every day as the students are cycling in and out, in the classrooms, I don't know if Mr. Cahill is on the, is on this call. I mean, Walter, if you are on, you can certainly chime in and explain in even more detail than I am, but again, the in-between class cleaning, that's just not something we're going to have enough staff to hit every classroom. And as you said, even, have things dry and so forth. The wipes is, what we have come up with and what other districts are moving toward as well.
Yeah, there really just is not enough manpower. If you were in the high schools, even if I had my entire staff, working day shift, there's not enough time with the 3 minutes between class changes to disinfect everything. Our options are limited. We do have some EPA approved disinfectants, We have one that has a 30-second kill time. The others are 4 minutes, and one of them has a 10-minute dwell time. So the 10-minute dwell time is great for the evenings. The 30-second and 4-minute is that's what we'll use in our electrostatic sprayers. It's a very fine mist that actually electrostatically adheres to anything that it touches. But again, just the amount of actual electrostatic sprayers that you would need to accomplish that, it's just not possible. The only other alternative, would be to, either have the disposable wipes or the actual cleaning product in the room. And I don't know how that would work because our staff are trained to use those products and chemicals, and I don't think it's something that we would want to be spraying while the students are sitting at a desk.
Mm.
The other strategy that the principals are discussing, we've been in meetings with them. If you've been to outdoor dining facilities, some people have noticed that in order to create social distancing, if they've left the number of tables there that they normally would have, but they need to skip like every other one now to create social distancing, they have like X marks or pieces of paper that indicate that table cannot be used. So in classrooms where all of the desks will still be placed there, there might be like a paper put on some desks like every other row to indicate that they're off use. And then it's only every other class, because then the new kids coming in would sit in the rows that weren't used previously. So it's really only every other class then where there would need to be cleaning or wiping down of desks.
Yeah, so it may look different from classroom to classroom, and then we'll employ all strategies that we can to achieve our goals.
Hey, Kim, I just wanted to be very clear about how we're getting this information to you, what we want to choose. If we want to choose the cohort or virtual, do we get a snail mail, or are we getting an email, or is it a phone blast? What should we look for?
Mrs. Walker, Mr. Ranella, did you want to talk that through? I know you've been working on that with Mrs. Calabro.
Do you want to handle that?
Yeah, so right now we're in the process of creating a digital form, either a Google form that will be sent out through School Messenger and placed on the website, or some other type of digital form. But right now we're looking to have it as a digital form, so that way the request will be sent back in and we can sort the responses.
Great, thank you.
And my understanding, Mrs. Walker, is that Mrs. Calabro has now been able to push through all new registrants, including our incoming kindergarten and our incoming pre-K, anybody newly enrolled. So all parents who have registered in the district and provided their email address or their contact, it's mainly going to be email address. That'll be the primary means of communication, but also a phone blast directing them to the district website. Everyone who has a student currently enrolled for September is now included and has been updated and pushed through in our system.
Kim, I have another question. Who's going to be tracking the forms that the parents have to fill out for the kids to get into school that day?
The health screening forms?
Yes.
Oh, I'll defer that to Mrs. Walker and Mr. Ranella.
Yeah, that is going to be like office staff. It depends, like a smaller school, a secretary could do that, and with the nurses' help. The larger, like high school, it's going to have administrators, guidance counselors. We haven't actually come up with the actual protocol of who is going to track the forms at this point. We know we're using either a form or an app. The committee has been looking at different apps that automatically populate into our PowerSchool system. But right now, we know we are going to have a screening tool. We know what that screening tool is going to include. But like Mr. Ranella said, we're still working on creating those different protocols. And like I talked about the pandemic response teams, these are the type of procedures that each school is going to create. The pandemic response team is going to help them create that. to meet the needs of that building. Because a Fairview with, fewer students than Nut Swamp may have a different procedure, and a middle school will have a different procedure than a high school. So there's a lot of requirements that we've built into this plan that are detailed, but they're not specific to any school. And that's the job of the pandemic response team, to create. So those teams will be getting started very shortly on figuring out the procedures, creating the procedures to actually implement the plan in a specific school.
I have a question. If either Mrs. Walker or Mr. Ranella, can you guys please just clarify again the language about face coverings, just so everybody's clear?
I can do that, yeah.
Thank you.
The expectation is that face coverings will be worn all the time in school. The reality is students will have to build up stamina for wearing face coverings. When appropriate, when students are in a classroom and are able to socially distance 6 feet apart, they will be getting face mask breaks, or whatever you want to call that, ability to take their face masks off for periods of time throughout the day by the teacher. Then we've seen it in ESY that, we were actually surprised at the stamina coming in that the students had to wear face masks. It wasn't foreign to them. They were wearing them for long periods of time, and the teachers are giving them also face masks. There are students that are not as accustomed to it, and they need to have more breaks. They need to have their stamina built up. But the expectation is that everyone will wear masks all the time, in school. Except there are exceptions for medical, some students may be medically excused from wearing a face mask. And for those students, we will make every effort to make sure that they are always 6 feet socially distanced in school.
Okay, thank you.
Were we able to contact any of the incoming kindergartners to invite them to a pandemic response team? Do we have any of the incoming kindergarten parents involved in this process?
I think the teams are just being formed right now by the principals. Each school is building their own team.
Okay, so maybe reach out to their principals if they ask me. That's what to tell them?
Correct. Reach out to their building principals.
Okay,
The building
great.
principals are forming those teams.
Yep.
Great, thank you.